Hi, everyone. We'll be introducing the guests that we have here today. There are our fellow CAB members. So I will let them go ahead and introduce themselves first.
Hi, everyone. My name is Madison, and I'm the Vice President of Hmong Student Union. I'm very excited to be here.
Hi everybody, my name is May Lee and I'm HSU's Public Relationship and I'm very happy to be here.
Hi, everyone. My name is Sabrina Tao, and I'm your HSU president. And today we're going to be here talking about COVID and how it has affected us, our communities, and just the members. But before we get into that, we kind of just also wanted to let you all know like the purpose or intent behind us creating this podcast for you all. So if like
Our purpose is to provide a safe space for members to share stories and um, to establish a platform to carry greater conversations on issues that we can all relate to within our society, cultures, and higher education.
Thanks, Madison, for introducing, the purpose behind this podcast. Alrighty. Okay, so moving forward, like we've all been mentioning, today's topic is about COVID. Um, we just wanted to share, like we said, our experiences that we've collected from the communities. Today, we were even able to have the opportunity to collect experiences from individuals who have already even received the vaccines and even individuals who have decided to not go with the process of getting a vaccine, and just seeing like their perspectives and grasping a better understanding of what's happening like right now in our communities. What is it that we can do to better support each other to overcome this pandemic, and what can we even like provide despite like everything that's happening around in the world. So we kind of have like guiding questions, but I guess like the first and foremost one is like, how have you all like been affected with COVID? Like, I know like Madison, you're back at home with your family, and May, you're with your family too, and you had like a whole like leasing situation going on due to COVID. I'm currently in Davis. I'm away from family, but also like really quarantining here too. So like, yeah, have your experiences been going?
Yeah, for me, I'm back at home in Fresno, California. I'm with my brothers and parents all the time, but 2 weeks ago, my parents, they got sick. They tested positive for COVID, and so we all had to stay home. My parents pretty much isolated themselves in their rooms, and my parents and we couldn't go to work anymore for 2 weeks, so it was very difficult. We had to call our workplace, and everyone in my family went and got tested. So, um, as of now, we're doing better. We all tested negative, and yeah, we're returning back to work and everything. But definitely, COVID um, created a huge stressor for my family and I. But I'm glad that I did get to spend time with my brothers. We played a lot of board games and watched a lot of movies. So that was the bright thing during this quarantine.
Yeah, in contrast to you guys, like I'm a frontline worker. Well, they consider us as frontline worker, but I'm working with Amazon and I'm back home in Sacramento with my family. But there was a lot of going on because of so much is changing and plans don't go the same way. So that's what that really like affected a lot of me and my friends and a lot of us is like the financial part where you had to work, but you're scared of getting COVID. And at my workplace, it took like 4 months to tell us a COVID case that happened at work. So one of the cases was in like February, and it wasn't until like, well, not February. The case was in September, and it wasn't until January or like until now that they told us about it. And so I was like, oh my god, that like the communication is so bad that like I could have been contracted with the COVID person. but that's something that was like really frustrating right now because I'm trying to pay rent and everything by working, but it hasn't been really effective because I'm scared of COVID. And yeah, I know a lot of people are in the same situation too.
Yeah, thanks for sharing. I think for me, like I like when COVID hit for us last spring, I had gone home and I said I would only go home for 2 weeks, but I ended up staying like 5 or 6 months until like I think August, and then I came back to Davis. And that was definitely like good and bad in certain ways, because like it was good in the aspect where like the year prior to that, like I wasn't able to spend as much time with my family just due to school and work related things, and then just being able to like take the time to be close to family, but also like quarantine because you can't be like too close, was also hard. And then being in a household with like four siblings at home, it was just kind of crazy. It's like something that I haven't been like used to for the past like 2 3 years being in college. And so going to school with them too, and everyone's at home, it, I swear, like it drove everyone like crazy. Where you would just get like annoyed with like the littlest things. And that was like when I was like, okay, I need to come back home. And then so when I was coming back to Davis, it was like getting a job too, right? Because I was like currently unemployed, and finding jobs that, like May mentioned, was safe too, and knowing the risks that you were taking if you were doing an in-person job. That was something that I didn't want to like expose like my housemates to. So I was trying to look for like jobs that I could do remotely, but that's also very hard as someone who like doesn't have like a lot of like, was it, I wouldn't say experience, but like we don't have a degree, and even those that have degrees, they're still having to go in the office. But finding a remote job right now is just really difficult. But I was grateful enough to find one as like an avid tutor that I can work remotely. But the downside of that is you don't get paid a lot. Like I only work like 3 hours a week. And so like it's not that much. And I'm always like having to think like, oh, should I get another job or should I pick up another one? But then COVID is also like really risky. So it's like having to risk that too. Like how much am I willing to risk of my life? Into like getting like money. I know people are like, oh, don't worry about money, like will come when you need it or something like that. But I'm like, I'm worried about it because like I got bills to pay, and like even though there's like a pandemic going on right now, like people aren't like stopping like your bills, right? Like no one's gonna help you pay them. And so it's just like it's just hard. I think like my mom was like, oh, why can't like your leasing apartment just like not charge you guys rent because there's like a pandemic going? And I was like, Mom, the real world don't like work like that. Like they don't care that there's a pandemic going. Like they need to get paid so then they can get paid too, right? And it's just like really chaotic. But yeah, that's, I think that's my experience so far with like COVID. I'm glad I'm back in Davis though, because like I'm away from family, but then I do like miss going back to my family. But also at the same time, this is like the safer route for me. Yeah, so now that you all have heard our experiences of COVID, I guess like I wanted to like add on to like Madison, like I had a question like, how is going to school for you like at home, like balancing that like work life and family life? Because you mentioned like you're spending so much more time with like your brothers now. Just how has that all been in your situation?
Yeah, I guess there has been a lot of goods and bads. I'll start with the goods. So being back at home, I've definitely gotten the chance to spend time with my family and brothers more, and I'm so grateful for that. Like, they're so fun, and like I just love hanging out with them, playing board games, and we're always playing Roblox. So I love that. And also another good thing is that I'm saving money. I like being in Davis, like I always had to take out a loan, and I would always struggle with like, just affording food. So I'm I'm glad to be back at home because yeah, I can like rely on my parents for now, and I'm grateful that they're still here and yeah, my family is around. What about you, May? Do you have any experiences that are different, like in being in Davis or
So I haven't been at Davis, but I have like gone to visit, and it's so different. They made us do a survey, and I don't think it's not as effective because like you could have COVID and it doesn't show, and the survey just says this and this, and yes or no, are you you're contracted with a COVID person or not? And by just saying simple questions, yes or no, checking a box, it doesn't like it doesn't prevent the COVID from spreading, and that's super scary because I I legit was kind of lying in that quiz when I was taking it because I could be having a headache, I could be having COVID, but I need to go in there, and so I went to go. I was just like just lie and go in, and nobody was like really checked, and they're just keeping people's words, like taking people's words for it. I thought that was really scary. But here in Sacramento, nobody cares. Like my neighbors and my mom, like everybody was like being such social butterflies towards each other because we're a home community, and we thought that that's okay because our community is based on social gathering, like social encounters. Like I would go to home stores, and the only home store that I see that actually takes it really seriously is V9 Market only, and the other stores they're just like it's whatever. And I noticed that there was one of the home store that I forgot what it is, but when you went in there, they all didn't even wear masks, and everybody was just thinking that it's another day, and it's not. It's scary. It's There's a lot going on. So that was my experience with COVID in Sacramento and Davis, like with transportation and going back and forth.
Wow, I didn't even know that there's like punk stars that they weren't even like wearing masks and things like that. That's crazy. And that kind of leads us to like the next question I wanted to ask is like, how do you feel the punk community has like been handling COVID in terms of like social distancing, social gatherings, what is it like when they do like jingle bells? Like, do you feel like those things should be put on hold, like funerals and stuff like that, or like, just like our like culture and like we're very like a huge populated like gathering event for all of the things that we do. So what are your all's thoughts on that? What have you been seeing and what do you think can be improved?
yeah, so being back in Fresno, where they host the big Hmong New Year, um this year they closed it down or they didn't host it because of like, the spikes of COVID cases. But other than that, like family members, like gatherings are a crucial part of our culture for some reason. Like people will keep gathering, and despite the the stay at home orders, people will, keep gathering, and you can only, I guess, do so much. I think maybe it's the lack of education, or maybe like they're not as afraid, because there's a lot of, um, I guess maybe because it hasn't affected home yet, then they're gonna keep gathering and, um,
I can say something.
okay.
Like, yeah, as you like, Hmong people are such like, Odako, and then like especially traditional Hmong people, we depend on the silo to guide us in our life, right? And so I think that's one thing that really like is the bridge between us not social distancing and us social distancing, because I know that like during this time it's when como multiple and when you really need to sitting or to silo to be there to help you. And for like our whole community, like we depend on the elders to be there physically. to guide us, because a lot of the things we do traditionally and culturally is it's physical. Yeah, later, or other stuff only. And like we're not at the point where we can make those virtually yet. And I think that's something that really affects our community because we depend on those stuff to feel better. And my mom, as a practicing shaman, they keep calling her, and I would tell her every time like, hey, only go if you feel that it's safe or they're really close to you and they really really need you to go. And like my neighbors will always come to our house, and like just 2 weeks ago they were at my house and they were like, oh, and one thing that my mom has been doing to help prevent the COVID is like through the phone. But even then, like it's not as effective for some reason. And I also noticed that like during funerals, like it's such a like paranormal moment that like like my grandpa one of my grandpa at Beijing in Sacramento here, he just passed away. And when we went to his funeral, like they did a really good job of like social distancing, but I still see that people don't wear masks. And like you said earlier, it's because it's not happening in their family yet that they don't see it happening. And I noticed that a lot in my family too. My uncle wasn't even scared of COVID. He would go around saying, "Oh, kuje como kamo do to kulu te you to come on COVID lot te ni ko ha couldn't battle kuje kamo ho kulu baria." And I was like, "No, that's not how it works. Like you gotta go get tested. You gotta make sure you're on top of everything so you don't have the COVID." And and then his friend got COVID, and that's when he really took it seriously. And my mom, who is also friend with that friend who got COVID, is finally taking it seriously now. So I think our community, we're more like tipo and that's one biggest thing that we need to understand, that you don't need people data. You need to know that the facts are there.
Yeah, no, I definitely agree. It's like they don't believe in it until someone close gets it or experience it, and then they'll get scared from it happening. And then they'll like be like, oh my God, okay, we need to go buy all this and that. Because in the beginning, I think my mom too, she was like she feels that she feels that she was the first one to experience like COVID. Like we think she experienced COVID in the beginning, but she didn't know it was COVID because before like the whole quarantine thing, she like came back from a trip and she was like really sick to the point where she said that like she felt like she was dying and it was hard to breathe and everything, right? And then after she got better, then COVID came. And so she like still doesn't really believe in COVID because she still be going out and stuff. And so we're just like, no, I think what you experienced before was COVID. We just didn't know that existed yet. And so she didn't buy hand sanitizer. She didn't buy like Clorox wipes or anything for the house. And my siblings were like freaking out, like telling her this shit's real. Like we need to take precautions. And like my aunts and uncles are like calling everyone like, did you guys already buy all this stuff to prepare yourself and things like that? But my mom was like chilling, and we were like freaking out for like my younger siblings at home, and we were like, okay, like you need to go buy, it. And then I don't think it wasn't until like she really like saw like things or like my siblings like yelled at her that she really went to go buy it. But that was already like 2 months into COVID, and then she went to go buy things. And it was like so like late, and we were just like, you could have taken the precautions before. But she didn't believe in it. And like I said, even now she still goes out and about and sometimes doesn't wear her mask. And that's also another reason why I don't go home, because I'm like, I'm not trying to like expose even more people to her, knowing like how her habits are too. And then going on about how you mentioned about like our all the cultural stuff that we are doing right now. I know like my uncle just passed away too, like last month as well. And so, and he's in Minnesota, and he's like the only like relative out there, so all of us are here in California. And I actually had to fly out to Minnesota during fall quarter, and at the airport it's very like strict. You have to have like your mask on or your shield on. And then on the airplane there's a seating between you and another person, but I heard that depends on the airline you're taking too. But we made sure to book flights for that particularly because we didn't want to sit close to someone else. And then we wore double masks. So I had on my regular clinical mask on top of the cloth one. And then my aunt even got us those shields to wear too. It's so hard to travel like that, but we did it just to go and visit my uncle before he passed away. And then they did the funeral recently too, and so not everyone could go for the funeral, also just because cases have been rising, especially in Minnesota as well. And so a few people went to the funeral, and they essentially, what we did to be safe for everyone and also to show support is that we did like not a Facebook, a Zoom call. So my aunt that went there, she did a Zoom call session of the whole entire like funeral. And so we will just like, everyone will just be sitting here like all day to watch it. And then my grandparents, like my grandma and grandpa, they couldn't go. We weren't gonna let them go because they're old, like they're way older too, like they're in their 80s and 90s, and we were like, we're not gonna risk them. And so the only way like my grandpa could see his son's funeral was through Zoom, right? And as sad as it sounds, like that was like the best safety measures that we could do for it, because just an elderly traveling is just so much work. And then like just older folks don't understand the like precautions they need to take with COVID. Like I took my grandma shopping one time, and she'll just like go and touch everything, right? Or she'll see like a friend at the store and she'll like hug them, and it's like you can't be doing that in COVID. And that's also why we like don't allow her to go shopping. Instead, like we tell her like, oh, if you need something, like just let us know and we'll go. But she wants it like right away too. And I think one time she like snuck out of the house to go to the store, and then like my aunt just got like really mad with her and like sprayed her down with Lysol when she came home and just everything. And so it's just hard for them too, because they also want to socialize as well, because old folks being cooped up all day, like it just drives them crazy. um Alrighty. Is there anything else that you all would like to add? Well, I feel like we talked about like what we've been seeing in our communities, right? But what is it that we can do to improve that in our community? Like, to decrease the rates of COVID cases within our Hmong population? What do you think should be embedded? Because I know they have like the Hmong news channels that older people usually watch, and that's how my parents find out about like COVID. But what else should be done?
Yeah, I can go ahead. Like I noticed that we all want to like shitana with the good and all that stuff, right? And like make new friends and meet new people. I think a really best ways or like advice I have for the community is like go onto the phone conference, you know, like the grandma or grandpa phone conference, because I know how fun it is to be on there. Like you don't have to physically be there, but then look it fills up your heart already. And I think that's something that we can look into. And like you need more information, like you can always like go on Facebook and social media, like take advantage of social media and the free stuff that are offered now because of COVID.
For me, I really like the idea of virtual Hmong concerts. I think that really helps our Hmong community stay home and um, still enjoy having friends and, musical entertainment online and, without the risk. And I think we should definitely have more of those because, especially because we didn't have Hmong New Year um, this past year, I think it would be a really great idea to have more of those.
Yeah, definitely. I feel like the Hmong community has done well in like virtual entertainments and keeping everyone busy from home. I think it's like the inner like families that like still like, oh, they think like, oh, we're in the same circle, it should be fine, and to just see each other, or go have a bear at this like person's house. Um, and they think it's okay, but they don't understand that like just that one space with them can cause like so much. um and I think that also ties back into what we were saying, is like they don't believe it until someone close to them gets it or they see it with their own eyes. And that's very unfortunate. But we live in a world where you can make your own decisions. And so if that's the decision you're making, and just understanding that the risk that you're taking too, and if you're okay with that, then I think that's fine, but also understand that you're exposing so many more people to it, especially like if you have loved ones that you care for dearly and you don't want to see them sick. I don't know how to emphasize the importance of that to them. Like if I live with my grandparents and like I know the risk that I'm gonna put onto them and like they're at higher risk because they're older too. Like I would avoid going places. I would avoid visiting them as much as like I want to see them. I know it's also hard for them too because they're always trying to come visit, but I would like tell them like, oh, you can't come visit, or you can just talk to me like at the window or something like that. That's it. But I just me personally, I wouldn't risk that safety of others. um and with that, and talking about our experiences and what we've been seeing at the communities, we also want to talk about where we're at now, right? Because right now we're at a place in COVID where we have this vaccine that's created already, it's being distributed. What are y'all's thoughts on this vaccination that's coming out, on who's getting first priority? Like, do y'all think it's fair? Distribution, I'm pretty sure y'all have been seeing a lot of things in the news too. So what have you all been thinking about all that you've been seeing?
I feel that it's great that our healthcare workers are getting the vaccine first. It kind of lets us make it help. It kind of helps us feel better and like we can trust it more. Um, for myself, I am a little bit iffy on it, but then when it does become widely available, I'm gonna look into it and we'll see how it goes.
For me, I'm honestly really, really scared because they made it in such a fast like time span. And my aunt is actually a registered nurse, and she was offered the vaccine, but she couldn't like take it because like it's such it's such a quick like they make it so quick that it's hard to like really know if it's gonna be effective or not. And I think that's what's so like scary right now because people are tested enough to show improvement, but what about the side effects? That's what she was scared about. And so I would advise to like stay at least like 6 months into the vaccine and then take it if it's really something that we needed.
Yeah, definitely for sure. And that's not even to account that they recently discovered a new strand and it's evolving. And that also makes me question like, oh, is the testing that we're getting now for COVID even going to be effective for that new strand, right? Or like is the vaccine that's coming out right now even going to help us against that new strand too, because it's evolving. And even though they made it in a fast amount of time, it's still not even fast enough for it when the strand is constantly evolving. It's different, it's affecting ages at different levels now too. And so with that, we also were able to collect what is it called, responses from Sutter Medical Hospital workers that already have received the vaccine. And so I'm going to share my screen of these, what is it called, shared stories that we received, and just get a little perspective on what it is that they are experiencing with this shot. So right here we have a lady named Katie Swenson, who is at Sutter Medical Center in Sacramento, and she is an ultrasound tech. And so the questions that we are asking these medical what is it, positions and individuals in these positions are that, what were your thoughts on the vaccine? Did you experience any side effects? Are there any myths that you can clarify? And then any other statements that you'd like to share. So here she says that she felt that there is enough science and trial and error behind it, and she felt it was safe to get. The side effects of getting the vaccines, in her opinion, outweighed the effects that COVID can have potentially like lasting even longer. So in terms of side effects, she had a sore arm at the site of injection later that night, and 5 days later, she was unclear if they're okay. So she doesn't know if they're related, but 5 days later, she caught a cold. She had sore throat and congestion for 5 days. Oof. And then, are there any myths that you can clarify? COVID-19 is not in the vaccine that they are administering, and her statements are get the vaccine. Okay. So she got sick 5 days later, but she doesn't know if that's related. Interesting. Um, let's see this one. This is Larissa Bisick from Center Medical Center. She is an ultrasound technologist as well. I was, what is that? I was counting the days down to receive it. I was definitely nervous because it's something new, but the benefits of it outweigh the risk. In my perspective, I feel very blessed to be able to receive the vaccine and get this protection so soon. No side effects for her. And she believes in science. She believes that COVID is real and that people, and for people that still think about someone who's out there trying to trick them into something, I just want to say that I have seen people with COVID, their agony, pain, and fear. So please trust the science and get vaccinated. So this is someone, front line. So we have something also very detailed here. So this individual has worked for a 500-bed hospital in Sacramento. Prior to the vaccine, they prayed that one would be created as soon as possible, even if it was finally here. It still took a long time, so many lives were still lost, and there's a lot of complications due to COVID still. And then many of these unfortunate souls died without their families and friends by their side. I think that's also a very sad part. They admit that there was a lot of negative talk about side effects that made them very apprehensive about getting the vaccine. But they also knew a lot of frontline hospital employees who have declined to take the vaccine, saying that it's too new, don't be a sheep, don't fall for the hype. It's not even FDA approved yet, and it's a way for the government to control you. These weren't quotes from the internet, and these are actually real quotes from this individual's peers and colleagues who, in fact, have also bachelor's and master's degrees. Um, Also, they mentioned that when it's their turn to pass, they would want to be surrounded by their family and be able to be, with their husband and children in hands. They would like to have the opportunity to say goodbye, but um, she also mentions that this is why I decided to consent to the COVID vaccine. One day the pandemic will be over, and I don't know when that will be, but I do know it starts with me. So they haven't received their vaccine yet. They are getting it at the end of this week. And they would have to wait 21 days before they can get the second booster. Um, and then I don't know the terms, but Moderna is what it was mentioned here, saying that she would have to wait 28 days for the booster if she gets the Moderna, but we do not get to choose which vaccine we get, but both are available to our hospital. Oh, so there's two vaccines that are currently out right now. I'm assuming it's the Pfizer and the Moderna. I personally don't know the differences. I don't know if y'all do, but that's unfortunate that you can't choose which one you can get, but that's also because it's hard to have that access to everyone. There's telling individuals who think that COVID is a hoax, and they think that who they think is that's being controlled by the government or whatever, a conspiracy, to stop because it's real and it's scary. Um, and they're lucky that they weren't able to lose anyone, but it's really scary for them. So I'm thankful that they were able to share that. What are your all's thoughts so far on these 3 stories that were shared before I go on to the provider who decided not to take the vaccine?
I'm very grateful that these healthcare providers they shared their experiences with us. It kind of opens a new light for me, and it makes me feel less scared to take it because, they're working on the front lines and they've seen both sides to what this virus can do. Um, so I definitely feel like I want to take it when it is accessible.
I personally think, can you guys hear me okay? Okay. I personally think that like what they're doing for us is like the biggest thing anybody can ever do during this pandemic right now, because it's like they're putting their life on the line after and after again, even with like during the Black Lives Matter protests, and now the like people like storming into the capital, the state capital, like this capital, right? And knowing that there's hundreds and thousands of people doing this big gathering publicly and being acceptable, it's for a good cause, but it's causing these frontline workers so much pain and so much like they had to go through like fix like helping these people, nurturing these people back to life and nurturing these people back to well-being, and now they're also taking the vaccine, being the first guinea pig that everybody has to like really see if they're gonna die or not, if they're gonna have the side effects or not. And I think that's very I'm very glad that they're able to be that strong for us, and I'm just so proud, especially our Hmong frontline workers. Like their parents or family members probably telling them right now that like you need to like we take a test like yeah like I mean I know that there are people who are gonna tell them that, but I think they're the strongest people that we have in our community to be able to like take a step ahead and actually take on the vaccine and show us that it's okay. I think that's very important.
Yeah, definitely. I'm glad that this is giving you all like more like reassurance on the vaccine, because we see so many things in the news, and a lot of it could be misleading, and it's hard to determine like what's the actual truth and what isn't. And so getting these stories from real frontline workers, those in the healthcare system, really reassures like what's the actual truth. And so now we're going to dive into the healthcare provider who actually chose to decide not to receive the vaccine. And here they mentioned that the studies have shown that the vaccine is 95% effective at reducing the symptoms associated with the virus. Therefore, they think that the vaccine is necessary to help end the global pandemic. Um, so that's kind of interesting, because then they say that they've opted out of receiving the vaccine. And then in terms of myths, they've noted that I've heard concerns that the vaccine can make you sick. There are reports of mild side effects, but severe reactions are uncommon in those who I know receive the vaccine. Any other thoughts or statements you'd like to share? As a healthcare worker, I am on the front line when it comes to battling the pandemic. However, I feel that my experience helping patients who suffer from symptomatic COVID-19 has increased my overall safety awareness. It is not for me to be vigilant when it comes to social distancing, hand washing, masking, etc., as recommended by the CDC to keep myself and others safe. In addition to having knowledge about transmission of the virus, I also wear the appropriate PPE. The decision to opt out is a question of quantity. Is there enough available for those who are at high risk? If I get the vaccine, am I taking from the elderly or those who with weakened immune systems? If so, then I can be compared to those who elected to strong arm lifeboats from women and children when the Titanic sank. There simply isn't enough of the vaccine for everyone. A recent report indicated that only 6.9 million doses are initially available. Of that amount, 2.9 million people will receive the first round of vaccinations, and then another 2.9 million vaccines are reserved for the second round of vaccinations for initial group. What about the rest of us? And I kind of agree with that, because that doesn't even account for the new one, the new strand of COVID, right? So what are your thoughts on this person's decision in like saving this vaccine to go towards an individual who currently is in need of it more than they are, despite them being a frontline worker?
I really respect the opinion of this frontline worker. Um, I do think that like every other vaccine, there are going to be opposing beliefs on whether that vaccine will work. Um, I personally feel like if you are going to be working in healthcare, you're going to be, you know, using your skills to assist people and their medical needs. You are going to have to put yourself first because people are relying on you to um, help them with any medical um, problems. So I respect the opinion of this person, but I just think that as a frontline worker, you have to put yourself first so you can continue to help people as much as you can. If that is what you truly want to do, if that's your passion, which is helping people, I think you should sometimes put yourself first.
Yeah, I completely agree with Madison because like in order to save someone, you had to save yourself first. And as a frontline worker, you can give them the vaccine, but what if you have COVID? Then you're just gonna end up making it worse for them because the COVID is never gonna die. It's just they're just gonna become immune to it, and so it's a great idea, and you're being super generous. But sometimes we had to think like see the bigger picture that in order to help someone, you have to help yourself so that when they help themselves too, then both sides are balanced and equal. And I think that's very important. But that was really generous of him to, or her to of them to think that they're giving it to someone else. But if frontline workers, they had to save themselves first because they're the one who's gonna keep saving more and more people over and over again. And that's more important than to save someone who just relentlessly think that it's okay to go out again after they're safe and then cause more harm to everyone else.
Yeah, no, definitely. I agree. Like, it's a heroic action for them to choose like another person's well-being over themselves. But as a frontline healthcare worker, that's that's really scary. If you were to be like the CEO of the hospital this person worked at, would you allow them to even work knowing that, they didn't receive a vaccine, or and they are still like treating people? Or just like, even if you weren't like a CEO, like, what are your thoughts on that? Like, knowing that the nurse that's treating you right now didn't take a vaccine, and they're giving you a vaccine, but something can also be contracted during that time.
I think it is a great idea for healthcare workers to get the vaccine, but at the end of the day, it is, people's right to choose whether they want it or not. Living in America, it's your choice it's your body, your choice. So I believe that it's up to this person. But if so, also I like to add that um, it could be up to the patient if that patient wants, a person who is vaccinated to give them the care that they need, or have a person that is or isn't vaccinated. I think the patient should be able to choose because, if it's your body and you should be able to choose what kind of care you want.
With that, then, if that's the case, because we say that vaccination is a choice, right? But if you reflect on all of our years of like schooling and education, wasn't vaccination required for us in order to go to school? And even now at Davis, like, don't we have to show proof of our vaccination record when you get admitted, and constantly whenever like a new vaccine is needed, right? They say it's a choice, but they still like push forward and still like want proof of it, right? And then that's not even to say that, I don't really know this, but are like medical professionals, aren't they, I don't know if this is a requirement for them, but I'm just assuming, maybe isn't it like a requirement to for them to like meet certain like health standards, like in terms of their shots, like did you get the flu shot, the typical flu shot, I don't know what the other shots are, but like that's just a thought of mine.
Yeah, that's true. I actually recently just got my tuberculosis screening, and um, I agree with you that yeah, it is required for a lot of job positions to have certain like shots and vaccinations. Um, but I guess like in the end, it does come down to whether you can afford it as well. Like everyone, like sometimes it's required, but then it all comes down to if you can afford it, and that's where government programs and medical like will help a lot of patients. So it's not just deciding whether you want to get the vaccination, it's whether you can afford it or access it.
The only thing I'm worried about the vaccine too is how it's going to get distributed, because I've been seeing a lot in the news that like you have to distribute it within a certain amount of time. It has to fall under a certain temperature. And it's like, how are you going to get it to all the people like they say they were, right? They said frontline workers, and then now they say like old people. But there's like old people who are at home that like can't like be mobilized to like a hospital or something, or like an elder care center, right? So are they gonna go visit everyone individually and diagnose them, or just like how is that all gonna work too is also another question. That's a lot of things are questionable in this situation. And so I'm just going to share these last few notes that we got from fellow Hmong and Southeast Asian individuals, Mian and Hmong, their experiences, which I feel like can be really relatable to us in our community. So yeah, Madison, would you like to read it? I feel like I was reading a lot, so I'll give you
Sure.
time to read it.
So this is from Tua Vu. Thank you for sending in your response. This person said, before taking the vaccine and considering taking it, my thoughts were that even though it was still early, I'd rather take my chances with science. Our technology has come a long way, so I believe that the vaccine will be as effective as they say it is. Since I am around COVID patients all day, it took a lot off of my shoulders. Knowing there was a vaccine was like a breath of fresh air, which is why I was so willing to take it. I definitely still wear the mask though, lol. The only side effect I experienced was soreness at the injection site. It lasted about a day, then it went away. Not sure what myths are going around, but I've heard people saying that the vaccine is going to give you COVID. No, it is not going to give you COVID. And this is Tiwavu at Sutter, Sacramento.
They also said, please add in there that there will not be a zombie apocalypse from taking the vaccine. I have not had any zombie-like symptoms since taking it. All right. And then just the last one to close us off, this was a specific letter written to us as fellow students. I am an intern pharmacist and currently a pharmacy student working at a pharmacy. There are reasons why I decided to get the I don't even know if I'm pronouncing this right, but the Pfizer vaccination. In my experience and when vaccinated, working in the healthcare field, it is part of my duty to take precautions in protecting myself and patients I encounter on a daily and care for. So I do feel a sense of responsibility to not contract COVID-19 and possibly spreading it to those who are elderly, ill, and immunodeficient, where the chances of their survival may be slim to none. Getting the Pfizer vaccination is one out of many precautions I can take, considering the pros of protecting a life outweighs the cons of the possible side effects. Upon receiving the first dose of the vaccination, there was little to no pain, and it felt very similar to the annual flu vaccine. However, a few hours in, I did feel a bit of a fever and fatigue that lasted only about 2 hours, then went away. 6 hours later, my shoulder where I got the vaccine began to get incredibly sore and worsened as the day went on. I was not able to sleep on the side of the shoulder or move it due to the soreness, and as the days went by, the soreness continued to decrease, and on day 4, it completely went away. All the side effects I had experienced were to be expected. No other side effects has occurred since. I can confidently say the conspiracy of a chip being inserted in is highly false, or the that is said to give you COVID-19 can be falsified as well. Over 300,000 people and increasingly daily in the US has died from COVID-19, so it is a very serious issue. Vaccines are created for many years now to help our immune system to learn to fight highly contagious and deadly diseases. If the chances of it not working was higher, we would continue to have increased infectious disease such as smallpox, measles, mumps, and so on. The vaccine introduces a specific mRNA into our body to use as a tool to fight against COVID-19. Even after being vaccinated, it is not 100% guaranteed to protect you from getting infected. So wearing a mask, washing your hands, and keeping a distance are still precautions we should all take. But it is definitely another step to protecting yourself and those around you. I encourage everyone to do their own research and have some faith in science. We can only get through this pandemic if we all work together and keep each other safe. Thank you. So thank you, Lysay Chow, for submitting this to us, and we appreciate this lovely letter. Just on a funny note, something that I wouldn't say it's funny, but it's just very interesting. But a lot of these healthcare professionals use a lot of stats, right, and like backing themselves up. They know their numbers, so that's very quite interesting. Um, but yeah, that's basically our wrap for our first podcast. Is there anything else you would like to add, Madison, to like our whole conversation on COVID, leaving like a message to our viewers on how they can continue to stay safe?
At the end of the day, I wish that you all are doing well, and times are tough right now, and there if you need any emotional support, definitely reach out to your loved ones, and we are here to support you as well. We are Hmong Student Union at UC Davis. If there's any more questions, you can feel free to message me or Sabrina. We are the vice president and president of HSU, and we'll be glad to help you guys out.
Yes, if you've listened throughout this podcast and have gotten this far, just want to thank you for supporting us and continue supporting this podcast this year. It's a new platform for HSU, and we're hoping it continues on. It's just a great way for us to like share your stories and for us to just give feedback and tips and advice for you all. So without further ado, please stay updated for our next podcast, and we will see you then. Alrighty, bye.
Bye.